Sisters and brothers, thank you for tuning in to CCR TV. There is a myth an apple a day keeps the doctor away. Well, I did not wear this shirt for that purpose because I don't believe in that myth. And today we are happy to have with us a doctor who is going to talk to us about something which has mystified me personally, and I would like to get some answers. We have with us Dr. Yuri Dias. Doctor, thank you for taking time off from your busy schedule and joining us here at CCR TV.
Thank you, Alfie. It is a privilege to represent St. Luke's Medical Guild on this program.
Wonderful. Now, I believe for the past 17 years, you've been practicing as a plastic surgeon?
Yes.
Is the title correct?
Yes.
Okay. So, why are you called a plastic surgeon?
It is a rather interesting thing. Plastic surgery is derived from a Greek word which is plastikos, which means to mold. Okay. So in our specialty, what we are doing is molding or shaping or forming tissues to achieve a desired outcome. Hence the name plastic surgery, which often is not very informative and may be confusing.
Precisely confusing because, nowadays people are talking about banning plastic. So, does that affect plastic surgery in any way? No. I guess not. But I'm sure that there is much more to it than just...
Yes. Our discipline covers two major subspecialties. One is reconstructive surgery. The other is aesthetic surgery. We are not really confined to any age group or gender or any particular disease or organ, but we commonly are called a problem-solving specialty because we handle things which other people sometimes need help in, besides patients coming in directly to us.
Okay. So, in a sense, you'll probably work with the
with other departments as well.
More than
No, we are independent as well.
No, so let's say, who would come to you directly? What kind of a patient?
So we have reconstructive surgery.
Right.
In this, we mold or shape tissues which are deformed and attempt to restore the function in addition to the form.
Okay.
So reconstructive surgery has several subspecialties or subdivisions. The common is the congenital anomalies or visible birth defects like cleft lip,
correct,
ear deformities, hand abnormalities.
Right.
These present to us directly often or through a pediatric reference. The other areas we cover are burns and its sequelae, reconstruction following malignancy surgery.
Right.
We handle a lot of trauma,
okay,
accidental injuries of the face, of the hands, where we either repair just the structures like tendon, nerves or arteries, veins, or sometimes actually reattach parts.
I see.
Other areas of our specialty are coverage of wounds, right, like either diabetic wounds or let's say bed sores. We also handle skin and soft tissue tumors, vascular tumors like hemangiomas, things like that. Microsurgical reconstruction is surgery which is performed on fine and delicate structures and,
for example,
arteries, veins, nerves,
okay.
under magnification.
Yes.
We also handle scars, keloids, leprosy deformities, nerve injuries. So it's a wide gamut really of procedures we perform, some of which are present directly to us and some through a referring doctor. So in reconstructive surgery, structures which are deformed or distorted are restored to near normal,
right,
as particularly with impetus on function, but also with importance of form being kept in mind.
You mentioned diabetic wounds.
Yes.
Could you give us an example of that?
We facilitate wound healing in diabetic wounds.
Does it take time?
Yes, diabetics generally heal slowly.
Yes.
But we facilitate wound healing either by using dressing techniques or sometimes surgical procedures.
Okay.
So,
but for a procedure for a diabetic, then the sugar level needs to be...
yes, the diabetics have to be well controlled.
Correct.
The surgical indication should be there.
Right. Now, what is the major difference between aesthetic surgery and reconstructive surgery?
So, aesthetic surgery covers structures which are nearly normal. Basically, we are trying to enhance their appearance, but more importantly, without compromising their function. So, we are molding tissues to improve their appearance, and here the importance of a connect or a link between the doctor and the patient's expectations, because very often these are procedures carried out because a patient wants them. So these would be procedures like facial surgeries for rhinoplasty, or maybe a age-defying procedures where we try to retard the changes occur related to age, like a facelift or a neck lift. We do body contouring procedures. That would be like liposuction or these abdominoplasties, breast reshaping, either reductions or enhancement, skin resurfacing procedures for scars, and maybe hair transplant is that also comes the aesthetic surgery. In aesthetic surgery, basically we are enhancing the appearance without more important, without compromising on function.
Let's say, for example, someone has a nose which is slightly oddly shaped. Now you have to ensure that he continues to breathe properly.
Yes.
At the same time to bring it into a certain...
What is his expectation?
Right.
There's no normal nose.
Yes.
But then each one has a perception of what he thinks would be what he wants.
My friends always tell me mine is like a bicycle seat. I said, well, then you're more than welcome to take a ride. Noses don't have a specific...
No. In fact, the gist of plastic surgery is very well captured in a quotation of Gaspar Tagliacozzi. He's an Italian plastic surgeon. And he says that we repair or restore tissues which are deformed, or make whole parts which are damaged, not just for appearance, but to lift up a patient's spirit and heal his mind. I think that's the gist of it.
Yes. Now, all these procedures, do they leave scars? I'm not talking of the emotional or the mental scars, but...
Yes, unfortunately, there is a concept that plastic surgery is scarless.
Okay.
Once the full thickness of the skin is disrupted, it has to heal by scarring, except if it is in utero or fetal wound healing.
Okay.
But plastic surgeons, by using delicate tissue handling and surgical sutures or things like that, try to make the scars appear as inconspicuous. We try to hide them in natural folds or where they are less visible.
Okay, but you cannot make a claim that it's scarlet. No plastic surgeon would.
Not if the full thickness of the skin is disrupted. Okay. Superficial injuries could heal without much scarring, but once you have an injury which disrupts the full thickness of the skin, no.
Now, not in the, let's say if someone has low self-esteem and wants to undergo facelift, for example. Let's take the example of a facelift. Would that be the most requested cosmetic surgery, like aesthetic surgery?
No, not in our setup.
Okay, but by and large, if you think
liposuction is the most common across continents.
But yes,
body
there
contouring.
Are risks involved in everything.
See, every surgical procedure, whether plastic surgical or any other, has some inherent risk. It has some side effects, possible complications. However, a properly selected procedure or a properly indicated procedure in a well-selected patient carries minimal risk. So the risk ratio is related to the doctor being selective and doing an indicated procedure in a properly selected patient.
Now people talk about Botox.
Yes.
Does that come under?
Yes, we are doing a lot of these non-surgical rejuvenations, or we call them non-invasive surgeries.
So how would
it's just some injections or other methods to improve appearances, which are not necessarily long-lasting, but they serve the purpose for functions or things like that.
Oh, just for a short while?
Yeah, sometimes Botox lasts not more than 6 months.
I see.
So they repeated injections
And-
they are used for facial wrinkles and small
But I-
camouflages.
But let's say after the 6 months, then
You need to repeat it if you want to have a...
otherwise, is it
The-
worse than what it was?
No,
or it goes
no,
back
no.
to the
It
original?
reverses to back where it was.
Okay. And is it reasonable, in terms of finances? I mean,
Yes.
yeah.
The
You can afford-
clientele who looks for those are usually
usually-
affording.
Correct, correct. Recently, you celebrated something.
Yes, it was the National Plastic Surgery Day on 15th of July.
Okay.
And basically it was meant to increase awareness of our specialty and what we actually do. Because very often there's as you said earlier, a window or a screen about what plastic surgery is all about.
Yes.
Plastic surgery is often equated to aesthetic surgery or cosmetic surgery, which it is not. There's a lot of reconstructive surgery. And in plastic surgery, improving function is as important as improving the appearance of form.
And when did this start? How many years
About
ago?
4-5 years back.
Okay. So this
Now
is-
we are looking at having an International Plastic Surgery Day like the
Ah.
World Yoga Day.
Okay. I think it's important, no? Because
Yes.
people may not be aware. So you'll have some seminars on that
Yes,
day?
we have programs
Okay.
on the day. Free surgeries are offered at certain
Oh, now you tell us.
ulcers.
I wish we'd known. Remember, block 15th of July 2019. And now India, I think, is, would you say, is on par as far as handling plastic surgery with
Yes,
the world?
definitely.
We've got the equipment and
We've
the
got the
hands,
equipment and
more
the
importantly.
expertise.
Yes.
It is available.
And what are the latest, technological or whatever developments?
Yes. Exciting developments are in transplant surgery now.
Okay.
So we have hand transplant surgeries for patients who don't have their hands,
The full
bilateral
hand?
amputees, yes.
I see.
Face transplant has been performed as well. Hand transplant has happened
You
in
mean,
India.
like that movie Face Off, like John Travolta, and you could.
It's used
it?
for burn survivors,
Oh, I see.
for traumatic injuries of the face. It's
But-
not happened in India as yet, but
But
hand
still,
transplant
hand has
has
happened.
in India.
Okay. What about bone reconstruction? Now, let's say in an accident case, does that also come under?
Yes, we assist in bone
You'll assist,
reconstruction. So, sometimes we have tumors of the jaw where a
Correct.
segment of the jaw is removed.
Yes.
We use the microsurgical reconstruction I mentioned.
Right. Right.
So the actual part of the body, a bone from another part of the body, along with its blood supply, is transferred to the jawbone
Okay.
and vascularized or given its blood supply by connecting those arteries and veins to arteries and veins of the face to restore.
Oh.
That's a part
Yes.
of this transplant surgery. Basically, the whole structure is reconstructed along with its artery, veins, nerves, so that in addition to the form, function can be achieved.
What made you choose, plastic surgery?
It was a fascinating discipline. There were nice things too, which
Because
I was
when-
attracted to during my earlier surgical graduation.
When did you have to make this choice? In 2001 or before?
No, I chose it, picked up plastic surgery in 98.
So that time, 20 years ago.
It was an emerging discipline and, well, it is a satisfying discipline.
No turning back.
No,
Yeah.
surely not.
Okay. Well, if you could share with us, without breaking any confidentiality, one of the most challenging cases that you've handled so far. Has there
No,
been
each
anything?
patient is a challenge.
Every patient, okay.
In fact, one of our teachers used to say there's no minor surgery, there are
Okay.
only minor surgeons.
I
So
see.
each surgery, you
That's
need to do
very-
your best and
Right.
in the best interest of the patient.
Okay. The longest operation you had?
Yeah, that's 12 to 16 hours. This microsurgical reconstruction takes a lot of time
Okay.
because you need to work on delicate, fine structures, both at the site where you're doing the surgery and the site from which you're taking tissue to transfer to the recipient site, what we call. So say we have this jaw tumor, which I mentioned to you.
Yes.
The first part of it is getting the jaw tumor out, identifying blood vessels and other important delicate structures in the recipient site. And then you have a donor site, the site from which the tissue is taken to replace it.
Right.
So that could be a leg bone.
Okay.
We need to prepare the vessels and the structures down there and then transfer it and reattach everything.
Correct.
Even these reattachment of parts which we do, like in amputation of digits or extremities, loss of the scalp, amputation of ears. These parts, when they are reattached, are long surgeries generally.
I could well imagine. And how long? There must be a lot of post-operative rehabilitation, or what you call it.
Yes, we need to help the patient restore him back to his normal job. He has to get back to his normal function finally at the end of it.
But let's say a hand attachment. How long would it take for the person to, be
Restore.
able to? Yes.
It could take up to 6 months for a near normal function or close to its preoperative existence.
Correct.
The important thing which I would like to mention here is very often we come across patients' amputated parts being transported to the hospital.
Right.
It's important that people understand and know the proper procedures for this. If you have a part which is amputated, be it a finger or a limb,
like say you're caught in an accident. And
yes,
that's what you mean.
or industrial accidents,
Yes.
accidental
Yes.
injuries. It is very important that the part be transported in a way that would facilitate its salvage. So let us assume there's a finger which is amputated.
Right.
The correct method of managing this would be to place it in a clean bag, and if normal saline is available, transport it in the plastic bag with normal saline, and use the whole plastic bag immersed in another container which has ice in it. That is the proper method of storage. Very often we get parts coming in placed directly in ice, which is actually counterproductive. So the proper method of transport facilitates work.
I think there in those first
few hours, as soon as possible.
As critical
Yes.
as possible. I hope there are lots of would-be doctors who are watching, or maybe parents of children who are studying at GMC. If you could share with them the scope which is there now in reconstructive and aesthetic surgery.
Reconstructive procedures are always part and parcel of plastic surgery. There's a lot of work, particularly in the medical college, but outside in the open field as well. Aesthetic surgery is an emerging discipline. There are more and more patients coming forward for these procedures as awareness increases. So definitely it's an emerging specialty.
So there is definite scope.
Definite scope in this.
And have you ever had any opportunity to travel abroad for a seminar or a workshop? Or
I've done 2 fellowships abroad, one in Paris and one in the United States of America last year. I basically gained additional expertise in burns management, in hand surgery and microsurgery, and a bit of aesthetic surgery.
How long were you there?
I was there for about 2 to 3 months in each of these places.
Okay. So did you get an opportunity to actually...
No, we can't actually operate there, but we pick up observerships.
Okay.
So we can utilize the knowledge gained because the principles remain the same.
True.
It's just implementing them here.
Yes. So I don't know, some of these medical serials, which have become quite popular now, they show sometimes some surgeons practicing on like a skull or this, not a real.
Yes,
so
we have dummy procedures which can be done. Cadaveric dissection is also surgical procedures. We have them as workshops and part of training.
Okay. So it is important.
Yes,
is it
definitely.
Or mandatory? Is it mandatory?
Not mandatory, but it assists or helps you with your procedures. So it enhances your skills definitely.
Okay. How easy is it to be, a doctor, and try and balance family life? Have you managed that well?
Yes, I think I managed it okay, but it is a constant tussle between your work and family. Fortunately, plastic surgery is not a very busy emergency discipline. So we have relatively semi-emergency, or there are emergencies definitely, but we do get some time with our families.
Because it's always a challenge. few thoughts on the St. Luke's Guild,
St. Luke's Medical Guild,
Medical
particularly in the last few years, has been doing tremendous
Yes.
work, creating awareness for patients, for the members, and I think they are going places.
And are there many plastic surgeons in the guild
We have very few plastic surgeons in Goa.
itself? Do you all have
No association
or
in
a
Goa.
WhatsApp group or something like that?
We are part of WhatsApp group, but national or regional
Okay.
WhatsApp groups.
But let's say if you want to get in touch with a senior plastic
Yes,
surgeon.
definitely. We are in touch with them.
So that's always nice, as we call like a
It's
community
always
of
plastic surgeons.
community of plastic
And
surgeons.
it's always good that we have options which when we discuss cases, they give us some inputs which are definitely going to benefit the patient.
I was handling a conference once and I saw a cochlear ear transplant.
No,
What is it called?
cochlear implants.
Cochlear implants.
That is being handled by ENT surgeons, the ear, nose, throat
Okay.
surgeons. We don't get into
We all
that.
don't get into that. Okay. Because the term plastic surgery was not mentioned at all in that.
No.
I think because it is repair.
But it is not what
okay.
we do.
Okay. Any thing you'd like to share with viewers?
Another important information I would like to give patients or people when they handle emergencies like burns.
Right.
In burns, it is important that following a burn, which may be thermal, that is spillage of hot liquids, or actual contact with flames,
Right.
or maybe even acids or other corrosives, it is important that as soon as possible and as long as possible, the affected part is irrigated or washed with copious and large amounts of water, simple water which is available on the scene at room temperature. It should be washed well. This limits the depth of the burn injury.
Okay.
And I think this is a first stage measure everyone should know. We do it at home.
So just running water?
Yes, running water.
Okay.
It helps to limit the damage,
Okay.
besides providing some amount of pain relief to the patient.
As well. But nothing to be applied.
Preferably not.
Not.
Preferably not.
Okay.
Because we do come across many people coming with all sorts of local applications
Yes,
which
some
are
ointment,
not,
yes.
which do not facilitate our wound care.
And they don't really help.
No, they
Yeah.
don't. We are not sure they help.
Correct. You haven't seen any concrete
We
evidence.
usually take them off.
So I guess that way. And anything else you would like to share your philosophy as a doctor?
A patient who comes to you is often a person in need, and we are an instrument to help them fulfill their need. It is important that the patient be well informed, and the doctor does a procedure for a patient which will give him an optimal outcome and with the least side effects. So it is not just that we would like to operate on every patient which comes to us, but we would like to help the patient restore his health in a way which would be with least complications or least side effects and a very good outcome. A satisfied patient is what we are looking for.
Absolutely wonderful. Well, I hope we all have been enlightened. I certainly have, cleared a few cobwebs in my mind. I have now reconstructing new ideas about plastic surgery. And in this digital age, really there is no excuse. Now all the information is available on the internet. It's just a matter of going there, finding out research. Because if you need any kind of plastic surgery, whether it is aesthetic or even, reconstructive.
Not everything available on the net is
True. Yes.
It has to be taken with
Good
degree of
proverbial pinch of salt, if I may say so. Use it as an information gateway to get to some point from which
with discretion.
With discretion, and for a more detailed examination or investigation, I think GMC is the best place. Dr. Yuri is there, and from whatever I've seen off the camera as well, his gentle manner has a very calm and reassuring effect. So
Thank you, Alfie.
Thank you, Doctor, once again for taking time out.
Yeah, I appreciate you. And thanks to the St. Luke's Medical Guild as well as the CCR TV team.
Absolutely. It always is uppermost in our mind because health matters.